can be in, you think? To perform horizontal abduction.
Would it be elbow flexed and
Elbow flex and,
then shoulder abducted?
yes, okay, so can you go
90
into what we
degree?
call 90-90 position?
Yeah, 90-90.
Okay, so arm down, like that. Right, so is she slightly adducted right now?
AD.
Horizontally adducted, slightly.
Yes.
Yes, a little bit. Alrighty. Is it gonna interfere with the test a lot?
No.
No, because you know what? If it's not goniometry or anything like that. Alright, goniometry is more. If you remember goniometry, you want them in as neutral as possible. For manual muscle testing, not as much. If you want to fix it, what would I put there?
Towel.
Towel. You would just stick a towel. So, during the practicals, make sure you have whatever you want within reach. Okay, whatever you want. Okay, the room, she wants it, obviously, right? Because she's probably not as comfortable because I took all her pillows away. Alrighty, because I do need to have her as close as possible, her whole trunk in a good position. Alrighty, not hyperextended or anything like that. Okay, alrighty. What also may help, you can turn your head either direction if you would like. Alright, to sort of make it comfortable.
Maybe take off.
No, not really. Okay. Alright, we're gonna have to do this as quickly as possible because she's really not that comfortable in this position. So keep that in mind when you're in the clinic, when you wanna take a look at somebody's, for strength testing intervention. How comfortable are they? So, alrighty, what muscles again are we taking a quick look at?
Oh, deltoid.
Which one?
Posterior.
Posterior deltoid.
Oh, because that does.
Okay, so, looking
I
at
mean, horizontal.
where is it? So I would want to do the first time around, see how well she does. Can you bring your elbow towards the ceiling for me, please? Okay, not your elbow, not the forearm, the elbow here. Point it, bring it straight up. Very good. Try not to twist as much as you can. You guys behind me definitely can't see, can you? Come gather. And bring it back down. All right? Okay. All right. Right? So I saw her bring it up. She really did not rotate her trunk, roll her chest, anything like that.
But she lifted up her shoulder.
She lifted up her shoulders a little bit, okay? But I want you to do the same thing again without lifting your shoulder off the bed, okay? Alrighty, on the count of 3. 1, 2, 3. Okay, good. Thank you. And back. Alright, to make sure she doesn't do that, what would I do?
Maybe just stabilize it.
I would just put my hand right here. Alrighty? What also, besides stabilization do I get to do?
Palpation.
Palpation. I get to palpate the muscles. Alright, can you do it one more time for me? 1, 2, 3. And there she goes. There goes her posterior deltoid. So I see that she's lifting it up against gravity now. Alrighty, so what I'm gonna do, alrighty, I'm gonna resist the motion. So I wanna make sure I'm definitely below the deltoid tuberosity. Alrighty, and I'm gonna apply resistance, okay? I'm gonna give you resistance, okay? You give back whatever you give, alright? Whatever I'm giving to you, okay? And vice versa. Alright, so on the count of 3, 1, 2, 3, go, 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 go. And you can see, what is she doing? You guys saw it?
Her leg.
Alright, her leg. So yeah, if
It's like a
she is
reflex.
really trying hard to, basically what we call overflow to the other muscles to help her, you're gonna need to change your position slightly to prevent it. Alrighty, I'm gonna be changing my position this way now to sort of hold down. I palpated already, so you know
Okay.
I'm doing that. Alrighty, so on the count of 3, do it one more time. 1, 2, 3, go, 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 go. Try not to twist and back down. Alright, for her. I would grade her 3+ out of 5 at this point. Okay, her posterior deltoid. Alright? Don't do that. That's not nice. She's doing quite well. Alrighty? Okay, so horizontal abduction, gravity eliminated, is what position?
Gravity eliminated.
Gravity eliminated.
Sitting.
Sitting. Okay, can you sit for me? Thank you. Yeah, you can sit here. Okay? Alrighty. And we tested your left. Okay? Is it important to test the right also? Yes, absolutely. Hey.
Oh, because the
switch
first
to me.
position we was in, we was going
Yeah.
against gravity. And then this
Well,
one,
you tell me.
it was going against gravity, and this
Yeah.
one's gravity eliminated.
Yeah.
Oh, all right.
Alright, so, alrighty, so what does she absolutely need to do first to get, for against gravity eliminated? She needs to make sure she goes, baby duct, alrighty? Now, what I'm gonna do, try to drop it in my hand as best as you can, okay?
You're switching arms?
She doing her left or her right? Which one did we just do?
All right.
Oh, do you want me to do your right or your left? Your right, okay, let's go that way.
You
Go
can
that
just
way, no. Go this way, come this way. Alrighty? I have her sitting on the plinth. Okay? I have her sitting on the plinth. Alright, for me. Alrighty, can this get uncomfortable after a while?
Yeah.
Yeah, I'm gonna get uncomfortable. What other position would I have in, or sitting
in the
where?
chair.
Sitting in the chair, okay? I'm just gonna, for time's sake, I'm just keeping her here, okay? So I'm gonna be supporting her, okay? Drop it, as best as you can, good. She's definitely dead weight, because if I let go right now, she's probably gonna drop all the way, alrighty? What do I need to sort of keep an eye on?
Back extension?
Maybe a back extension, back, anything, trunk flexion, anything like that, okay? So on the count of 3, can you bring your elbow towards the, towards the back of the room for me, please, or the front of the room, okay? 1, 2, 3, and I'm just gonna go with her and see how much she rotates. Try not to twist as best as you can, okay? I'm gonna keep my back here, my hand here, just to make sure, okay? On the count of 3, 1, 2, 3, good. Alright, also doing, can you do it one more time? Gonna get the muscles here. Can you do it 1, 2, 3? Good job. Alright, then bring it back down. Alright, if I want to, what other test I'm gonna be able to do right here? AED deduction, very good. AED deduction. Okay, so I'm gonna perform shoulder horizontal AED deduction, right? In a gravity eliminated position before I do that. What muscles?
Anterior doesn't.
Anterior deltoid. Okay, so where is her anterior deltoid? Okay, yeah. Okay, what else? What other muscle is involved? Pec major, okay. Alrighty, so you're gonna wanna sort of, definitely, again, gravity eliminated. We wanna make sure, you know, she's using the muscles that she's supposed to be using. Her anterior deltoid and her pec major. Okay? So we're gonna need to palpate for that, because when it's gravity eliminated, when we're testing in gravity eliminated, basically, why are we testing gravity eliminated? Because they're what?
Weeks.
They're weak, all right? We wanna make sure they're not substituting. You guys probably won't see it that much because you guys are relatively healthy, all righty? And you have relatively good strength, all right? So I'm gonna need to make sure to palpate, right, for the muscles, okay? Now, when you're looking at the anterior deltoid and the pec major, you are gonna sort of get into, you know, a little, you know, touchy area. Alrighty, so you want to make sure you let your patients know, okay, that you're going to place your hands in a certain area. And for the pec major, where is that? You know, right here, alright? This is a danger zone, okay? This is a danger zone, right, for anybody, okay? So you're going to need to explain. Now, sort of what you want to do is also maybe palpate a little bit more towards the tendinous junction, not so much the muscle fibers itself, if possible, all right? Now, you're gonna explain that to your patient, all right? You're also gonna cover them as needed, all right? Did you do draping yet?
No.
Okay, all right. Draping for this in a sitting position, where would it go? Where would I actually put the drape? Right here, alrighty? Now, okay, we'll use this for now, alrighty? I would have my hands right here, alright? It'll probably be a little bit longer, by the way, okay, to make sure it goes all the way around, alright? And I will put my hand in a spot underneath, alright? And I would tell her, I'm gonna place my hand underneath the towel now, just to see the muscles, okay? And feel for the muscles, alright? Is that okay with you? Okay? Alrighty, I am gonna take the towel away so you guys can actually see where I'm palpating in a minute, okay? Alrighty, so I would just put my hand here, alright? Right? And just feel for the muscle contraction. And you just go into a little bit horizontal AED deduction so they could see. Right? 80, the other one.
80.
and I would feel for the muscle contraction. Alright, so, looking at that, I'm gonna take it away, okay? I'm gonna put my hands right here, alright, to feel for the muscle contraction. Because you want, again, let them have as much control of the situation as possible. Alrighty, so bring it, ooh, right here, okay. Yeah, I'm better this way, okay, ooh. And
Do you want the
bring it here.
stool thing?
Okay, I want you to slowly bring your arms across your chest for me. Can you do that? All right, on the count of 3. 1, 2, 3. Okay, and I'm gonna be watching for her, making sure she feels comfortable when we're doing this. Okay, making sure, you know, I don't see any substitution or anything like that. And I'm gonna have my hand, like sort of right over her shoulder, alrighty, so I could get as much of the pec major as I can and the anterior deltoid. Initially, I did feel her anterior deltoid and then her pec major. So on the count of 3, 1, 2, 3. Alright, and back. Alrighty? Questions about that? Yes? Alright. For horizontal adduction against gravity, what position would that be in?
Supine.
Supine. Okay, wanna go that way?
Hello?
Alright, and I'm gonna give her a pillow for this, 'cause it's not gonna interfere that much. Okay, it shouldn't. Okay. Are you comfy?
Yes.
Okay, can you do me a favor and just scooch over towards your left? Okay, just a little bit. Alrighty, so, alright, you wanna make sure they're comfortable. Can you bring your arm out to your side? Alrighty, again. Now, is this a little bit more precarious position than, say, sitting testing for it? Do you feel as comfortable, Sue? Okay, she feels comfortable. But thinking about it, just looking at her and what I just did, do you think this is a precarious position? Possibly. Okay. All right. A couple of you guys do say yes. So you want to make sure. Because what is she doing? She's in my position.
Laying down.
She's laying down, okay? This person doesn't have as much control as she does when she's sitting because she changed her position slightly. This is a little bit, you know, kind of that danger zone thing, alrighty? So, you're gonna, again, ask them, are they comfortable, alrighty? Right? And if they say yay, yes, okay, yay, you get to do it, okay? Get to perform the manual muscle test, intervention, whatever it happen may be, alrighty? But you always wanna make sure that the patient has some type of control.
Oh, that's
the
what you mean
situation.
for danger, like,
Yeah.
because you're over top of it.
You're over top of them, alright?
Yeah.
I'm leaning right up against them. My hand is not in a good spot, is it? Alrighty. Alright, for me to do this now, I'm probably not gonna be that comfortable doing it this way. I'm gonna be most likely this way doing it, alright? So you wanna be aware of these situations. Because, you know, if they're not comfortable, do you think they're gonna do whatever you ask them to do? Alright? This is, you wanna be careful, cause you guys are gonna get to massage and myofascial techniques in, well, probably in another month and a half or so with Professor Ross, right?
Yeah.
Right? You need to be careful about things like that, okay? You wanna make sure that they're okay with it, alrighty? We're okay with it because we know what, you know, we know about anatomy, we know, you know, it's just a therapeutic technique. We don't think about it. But if you're talking about a person who is first time coming to therapy, don't speak the language, have no clue what therapy means, right? This can be a little bit uncomfortable for them. So you want to be sensitive about all this. You want to be culturally sensitive about these things. Whether it be a man, woman, whatever, okay? You want to be aware, right? Now, so for this, okay, yeah, definitely the towel, alrighty? Or sheet, whatever happens to work, okay? Alrighty, so she feels comfortable. Cause sort of think about it, you guys ever have a 12-lead EKG done to yourself? Or have it been done? Yeah, right? What do? They take, you're in a doctor's office, they put you in a gown, alright? And you're basically, okay. You can't really have any metal on you when they're doing it, alrighty? So, especially for women, alrighty? It's kind of, I don't feel as comfortable. And there was one place where it was basically a guy doing it, and I said, you know what, can you get somebody else to come in here? Alrighty? And it can be a female office worker person. Alright? It's your right as a patient to ask for stuff like that. Hopefully they can comply. Alright? Hopefully they will comply with everything. Okay? Alright, so, okay. Now, same thing. Is it okay if I take the towel away, Sue Ann? Okay. so they can see. Alright. So again, she's gonna be in 90 degrees of abduction, and 90 degrees of elbow flexion. Alright? Now, can I see you bring your hand across to the other side for me on the count of 3? 1, 2, 3. And I see it, and she goes it nice and well across against gravity position. This time, bring it back. Alrighty. I'm gonna put my hands on your upper right side of your trunk. Is that okay? Alright? She says yes. Okay. So I'm gonna place my. I just want to feel for your muscles contracting. Okay. So on the count of 3. 1, 2, 3. Alright. Gonna probably move out of the way a little bit, and bring it back down. Alright. Good. Alright. Now what I want to do now is add some resistance. Okay. So whatever I give to you, you're gonna give back. Okay. I'm gonna place my hand here. Right. On the count of 3. 1, 2, 3. Go, 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 go. Alright, do you guys see what she did over here?
Kind of-
She lifted, alrighty? She didn't lift when I was palpating or actively doing it. So, I'm gonna need to sort of stabilize it. If I was gonna stabilize, what would I just simply do? Put my hand on it. Is this
Yes.
sort of like, ugh,
Maybe you can go
kind
like
of
over
thing.
there.
I would have to either come up here,
Yeah.
hopefully it works out, alright? Because, you know, some tables are against the wall. You're gonna start moving the table and all that? Probably not. Right, so I'm gonna be over here at this time out. So I'm separating everything now. The palpation, the resistance, the active motion of it, all in 3 different times, okay? Right, so on the count of 3, I want you to do the same thing again. Try not to lift this up as best as you can, okay? 1, 2, 3, go, 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 go. And yeah, she's strong. And you know what? For me, I felt I was giving better resistance biomechanically this way. Alright, so as I'm doing this test, I'm gonna have to take in consideration everything, okay? Because there are times, because this was just not here, at the head position, was just not biomechanically good for me, right? Here, I could get more biomechanically, because I was able to sort of bend my knees a little bit, lean into the patient, okay? So I could use appropriate leverage. Appropriate leverage may make a person feel uncomfortable. Yes or no? Okay, so that is horizontal ABA deduction against gravity, gravity eliminator.
Oh,
Good.
The first one was gravity eliminated.
Okay?
Mm-hmm.
Alright, cool. Yeah?
So that's against gravity.
Yeah.
Mhm.
What she did is against gravity. This one's for. Because when you're doing a gravity eliminated, she's sitting down, right?
Yeah.
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 Mhm.
So that for sitting is gravity eliminated.
Alright,
Here we go.
sort of, again, think about which way is gravity?
Down.
Down.
So
So
if you're going
think
against
about
it-
gravity first, okay? Think about which way is gravity. If you know, think about the motion, think about gravity, and which way you have to move that arm, leg, whatever part of the body against gravity. Because gravity is always down. First line of resistance is always gravity. Okay? Alright, what's next? Internal, external, right? Okay, good. Okay, so, okay. Alrighty. Sorry, can you go prone? Yeah, thank you. Alrighty, which one? It's up to you, it's up to you. You wanna do, okay, no problem, I'll come over. Okay. Alrighty. Okay, so when you're doing gravity against gravity, think about it, is internal and external rotation, alrighty, of the leg or the shoulder, alrighty, when we're doing it this way, alrighty, is it against gravity when we're
Wait.
doing something like this, or like this?
No.
No, alrighty, when we're in this position,
Yeah.
okay, it's more against gravity. Is it 100% against gravity?
No.
Probably no, right? But it's more against gravity than it was if we tested it this way, right? So we're gonna have her shoulder abducted, right? and elbow flex to 90 degrees, alright? Okay?
90-90?
Okay, you comfy? Get yourself comfortable. And you know what? Always let your patients get themselves comfortable, alright? Because they'll tell. If they're in a totally different position that you would want them in, okay, then yeah, you gotta put them in a position. But always let them lead you into how they feel is comfortable, alright? Alright? You guys are probably gonna just say, lay down on your stomach, sit down on the chair, whatever, back, alright? But you're gonna do that all the time with your partners. But, like in the clinic, let them lead you. You want the towel again or no? What's up? You sure? Okay, alright. Alrighty, so, if I ask her to bring your hand up towards the ceiling, which one am I doing, by the way? In this position, hands up towards the ceiling.
Excellent.
External, okay? So can you bring your hand towards the ceiling for me, okay? Top of your hand. All right, on the count of 3. 1, 2, 3. Okay. All right, bring it back down. All righty. Try not to lift up as on your shoulder as much as you can, okay? All right, bring it up. Good. And back down. Good. Now, what muscles is that?
Infraspinatus. Infraspinatus.
Infraspinatus, okay? So I'm gonna palpate for infraspinatus. Can I sort of put my fingers under your top? Okay, alrighty. Okay. Spine, here we go. Can you bring it up again one more time? Ooh, and there it goes. Okay, bring it up. I feel her infraspinatus muscle coming right into play. Alright, right under my fingertips, okay? Now, technically, where should my resistance be? It should be on, well, not on the hand, okay?
Or sorry, the forearm.
Forearm, okay? Even though her infraspinatus muscle is inserting on the gleno head area, there's really no way I can resist there. I am gonna go over another joint below the elbow. There's not much I can do about stuff like that. Okay? Alrighty, so can you bring your arm back up here a little bit as best as you can? Alrighty, so on the count of 3, I want you to bring it up, and I'm just gonna resist a little bit, okay? Whatever you give me, I'm gonna give back, okay? Alright, so on the count of 3, 1, 2, 3, go, 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 and relax. And you can you guys see how it's sort of hitting the table? How would you ask her to do?
To
Yes.
move closer to
Yeah,
the
come a little bit closer to me. I didn't notice it, so a little bit too much now. Okay, right there, that's good. Alrighty. I didn't notice it till I started applying resistance, okay? So on the count of 3, bring it up again. 1, 2, 3, go, 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 and relax. I would still probably grade, at this point, I would grade her as a 3, right? Because I really wasn't doing resistance, and she couldn't get it up to her full range, okay? Right? And remember, you're just taking the information down at that point. What would I tell her to do for internal rotation? This is the same position.
Oh.
So what would I tell her to do?
Yeah.
Can you
Bring your hands to the back.
Bring your
bring your
hand
hand
to the back wall. Yeah.
Okay, go back in that position. No, go back in the position that you were. Alrighty. Do you want your arm a little bit more on the table? Would that make you feel more comfortable? Yeah, she didn't look comfortable. Alrighty, so you just need to be aware, okay? Can do what was it?
Bring your hand to your back.
Bring your hand to your back for me, please.
Towards the back.
Towards the back. Okay, good. Alrighty, alrighty. So again, use whatever words, okay, that you could get them to with the instructions. Not everybody. That's not going to work with everyone, okay? Alrighty, and you could see the muscle that came into play already, which is what?
Teres major.
Terry?
Teres major. Teres
Teres
major.
minor.
Major.
No, major.
Oh, is it
Okay.
major? Oh.
Yeah. Okay. So can you try that one more time for me? 1, 2, 3.
You mean
Very good.
minor.
Alrighty, good. Bring it back down. I'm gonna put my hand right over here by your armpit area. Is that alright? Alrighty. Can you bring it up one more time? 1, 2, 3. Okay, and I feel that muscle coming into play. Alrighty, I'm gonna add a little resistance now. For me, where do you think for me to have good leverage to do this? Where would I be? Would I be here?
Yeah.
Here. I need to be here, okay? Alrighty, so I'm gonna change my hand position, put it right here. on the count of 3, we're gonna do the same thing. 1, 2, 3, go, 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 and 3. All right, I'm not too much resistance, okay? All right, because I could feel her trying really hard by the palpation of the muscle. It was really strong coming in, but to be honest, I wasn't really doing a lot of resistance, okay? And again, resistance, the amount of resistance you guys are gonna do, it's just gonna come naturally, okay? And it's practice, and it's practice on different people, all right? Okay, so that is internal, external rotation against gravity. Gravity eliminated, okay? Right, we're gonna keep her in the same position, because again, we want her as comfortable as possible. Alrighty, can you just sort of come closer to the edge for me? Alrighty, keep going. So your arm, come close to the edge where your arm is basically hanging down, okay? Good, alrighty, and I'm gonna stay right here, alright, to make sure she feels comfortable, okay? And what I'm gonna ask you to do is keep your hand facing like this, okay? Good, alrighty, again. Alrighty, this is a most gravity eliminated position as possible, alright? Because your internal and external rotators of your hips and your shoulders are working already gravity eliminated position, yes or no? Does that sort of make sense?
Yeah.
Because it's in the plane of the horizon, alrighty? And that's this,
That's correct.
okay? And that's pretty much gravity eliminated, okay? We're doing the best we can, alrighty? So, if I wanted to ask her to do external rotation, what would I have her do? You guys on this side can see. What would I ask? This is the start position. I would ask her to,
Flex and adduct.
no,
Wait.
because it's only rotation.
Oh,
It's only rotation.
So her.
Yeah, there she is.
Her thumb would go towards the back of the room.
yeah, this will.
Yeah, okay. Can you
Turn-
turn your palm
turn
out?
your palm out.
Can you turn your palm out? Okay, and she did it
You could
already. I
say-
wasn't even ready.
You could say you could turn your thumb counterclockwise.
It would be
No, clockwise. Because
Clockwise.
this counterclockwise is this way.
Oh yeah, so
Okay?
Yeah, yeah.
Don't confuse the patients,
Yeah.
because they'll do something like
Yeah,
that.
yeah,
Alrighty? Alrighty, so can you turn your palm out for me, please? Thank you. Alrighty? What I'm gonna do, can you turn it back? I'm gonna place my hand right under her spine or the scapula for the infraspinatus muscle. Can you do it one more time for me, please? 1, 2, 3. Alrighty. Okay. I don't feel as much muscle action as I did before. Why?
There's no resistance.
There's no resistance, okay, and she's in more gravity eliminated position. Alrighty? Right? Can you, what would I tell her to do for internal rotation now?
Palm
Turn
in.
your palm in.
Can you turn your palm towards me now? Okay? On the count of 3. 1, 2, 3. Good. Alrighty. I'm gonna palpate for the muscle action, okay? Alrighty. Can you do it one more time for me? Go ahead. 1, 2, 3. Good. Alrighty. Not really feeling muscle action here. Try it one more time. Okay. 1, 2, 3. Yeah, a little bit better. Okay? Because again, she's in a more gravity eliminated position.
The muscle's not working as hard.
No, it doesn't have to.
Mm-hmm.
Alrighty? Doesn't have to. Good. Alrighty? So that's for internal and external rotation. Now, if she was really, really weak, what may she try to do to compensate, substitute? Yeah. Do anything. What
Kick her
may
leg
she? Right? She may what?
Like kick her leg up.
She might kick her leg up a little bit again. What else?
The trunk.
Bring her, what is it?
Her head.
Bring her head a little bit closer, anything, okay? So again, you're gonna need to sort of watch out for exactly what she's gonna do. Again, you guys are relatively strong, okay? So you guys won't see those compensations. What I want you guys to do is make sure, okay? All right, you good? Can we do more? Yeah. You sure? Okay, okay. Scooch over, okay? Because what we're gonna do now is the scapular muscles, okay? Your lower traps. Right, the serratus muscles, upper traps, your rhomboids, all those. Okay? Right, you need the pillow. Yeah, because with your scapular muscles, unless they absolutely say they need to have a pillow, you really should have them as prone as possible. Okay? No pillow. If if a patient wants a pillow, you give them a pillow, okay? Alright, so, I scooch over towards the middle a little bit. Thank you. Now, can you come up towards the head of the bed? Alrighty? Sort of like, like put your forehead over here. As best as possible. Okay? Alrighty, good. Alrighty, so, the first test that we're gonna do, you could pick your head up for a few minutes if you want to while we talk, alright? Alrighty, is for scapular depression and upward rotation, okay? That upward rotation component, when we do this, and when we do this, okay? So it's looking at particularly the lower trap muscle, alright? So what we're gonna have her do, now, looking at the back muscles, okay, all these upper back muscles like your traps, your rhomboids, the serratus and all that, do they function against gravity? You think?
Rhomboids?
Yeah, the rhomboids, any of these guys.
Scapular
Yeah.
retraction? Yeah,
Yeah, okay. What about in this position?
not really.
No.
Not really, right?
No.
What position are we in?
Prone.
Well, for testing the lower trap.
Prone.
Gravity
Eliminated.
eliminated already, okay? Now, when we're looking at testing the lower traps, when we're looking at manual muscle testing, we need to put them in a position where we could have some kind of, they're comfortable, we can actually do the test, okay? This would be if we are thinking of lower traps and we're thinking of that upward rotation component, we would be thinking of putting her in a sitting position or a standing position. Really, really, really hard to do a manual muscle test in that position, right? We could sort of do it indirectly by doing shoulder abduction or shoulder flexion, but at that point, what are we really testing? Shoulder flexion, shoulder abduction. We're not really testing the lower trap. So what we're gonna do is put her in a gravity eliminated position, alrighty, and see what she's, the muscle strength and the type, not the type, but the amount of resistance that we're gonna give, alrighty? I could tell you right now, most people don't have those strong lower traps or serratus anterior, right? Because those are the typical muscles, most people don't think about working on, right? Because when we do this, which one is that? Which part of the traps is that? Up. Alrighty. You see people do this for the lower traps in the gym? No, not really, right? If they are, they're doing the triceps more than anything else. You're talking about gymnasts kind of person, that's totally different. Alright? We're talking about patients, okay? Very different. Alright, so when we're testing for this lower traps, okay, we're gonna start with her in a prone position, and we're probably gonna need to rotate her head towards the opposite side that we're testing on. Alrighty? You are gonna be in what we call the Y position. Alrighty? Which basically, what does a Y look like? Alright? So, Swin, can you sort of keep your arm in this direction? Okay? Up this way. Alrighty? Up that way. Do you want both arms up there or just one, or are you okay with either one?
Oh, she really looks like
She's
a
better. Alright? What does this look like, by the way?
Oh, why?
A Y. She's in a Y position, okay? Or the Superman position. Alrighty? Alrighty, I usually like to use, if you're using a plinth, I like to use the corners. So it gives me a good idea. Because approximately, she is more or less at 130 degrees. So I use the corners of the table to sort of guide me along. Alright? So what I'm gonna ask her to do, are you comfortable with both of them?
Yeah.
Okay, all right. Keeping this arm extended. Actually, can you move up one drop more to the head of the table, or you're gonna be uncomfortable? Like scoot up towards the head of the table. Move up a little bit. Okay, she wants to stay where she is. Okay, which is fine. Right? Keeping your arm extended like this, okay? Turn your head the other way. Right? Can you, without lifting your trunk up, just lift up your arm for me, please? Okay? Right? On the count of 3. 1, 2, 3. Good. And this, if you're palpating her muscles, I'm gonna put your hair over here, okay? Alrighty. Lower traps, okay? Can you do it one more time for me? Okay? 1, 2, 3. Lift up. Alrighty. You will feel her lower traps contracting. Okay?
Any landmarks that you could?
I am just on the medial side of her scapula.
Okay.
Okay? I'm on the medial side, vertebral border of her scapula.
Okay.
Okay? Do it one more time for me. Good. There you go. Now, alrighty, what you want to do, making sure, alright, You wanna make sure her elbow's extended, otherwise you're not gonna be able to get an accurate test, okay? Now, and she did lift it, and I didn't see anything over here happening, alright, because I wasn't adding resistance, alrighty? So I'm gonna add a little resistance now. If she was gonna substitute, what do you think she would do here?
The trunk.
Her
Try to
trunk.
go like
Which part of her trunk?
upper.
The right side.
Upper? Okay. Alright, let's try. Okay, we're gonna do the same thing now. Which direction should you think my resistance be in?
Down.
No.
Down. Okay. So I'm gonna apply some resistance now to this movement, okay? Alrighty? Alright, so on the count of 3, I want you to bring your arm up for me. 1, 2, 3. Go, 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 go. Go.
Yeah, see,
Come on,
yeah,
lift, lift,
she's-
lift, lift, lift. Go,
she's
go,
already
go, go,
lifting
go,
up.
go, go. And what is she trying to do?
She's lifting up her upper body.
She's lifting up her upper body, and what else did you guys see with her arm?
I didn't.
Right?
She bent a little bit.
She bent a little bit. She went into more abduction a little. She went into a little bit more abduction.
Okay.
Alrighty? Because again, your lower traps, people don't work on it. Okay? Alrighty? Some people who are relatively strong with their lower traps, a lot of them do tend to lift up
I like
their opposite pelvis. Okay? She didn't have it. I could show it on somebody else later when I walk around. Okay? They tend to like rotate over because they're trying so hard to not lift up their trunk to do it. Okay? They'll lift up their opposite pelvis. Alright? So you sort of need to keep an eye on. For me, it was okay here in this position, to be honest, because to be honest, her lower traps was not that strong, so I didn't really have to give a lot of resistance, which means I didn't have to put myself in a better position to use my leverage. For me, for people who have I've done it, tested the lower traps in the past, usually I would be here, kind of in this position to apply it. Okay? Hey. Okay. Now, so is this more or less still in a gravity eliminated position already? Yes or no? Yeah. So for a gravity eliminated test, I would the only thing that you can do is look at how much she actually lifts up against gravity. Alrighty? So, if for her, okay, as soon as I applied resistance, she couldn't lift at all. Alrighty? So can you just sort of lift up one more time for me? 1, 2, 3. Alrighty? Try not to keep that shoulder down, okay? One more time. 1, 2, 3. Alrighty? I would take note of that position. And I would watch, alrighty, how much she's actually lifting. If it's looked like she's lifting, barely getting it off the table or the plinth, that would be a gravity eliminator test, okay? And you would grade her accordingly, alrighty? So you would think about grading her either a 4 or a 2 out of 5 at that point, because that's gravity eliminated. Does that make sense?
She's in gravity eliminated right now?
Yeah.
Yeah.
How is she in gravity eliminated?
Because you're looking at the lower traps alone, right?
Yeah, traps
The
are
arm
like this.
is not gravity
She's like-
eliminated.
Yeah, the
like
arm
this.
is it, but the trap.
But the
like
trap
this.
muscle
Oh,
is,
okay.
okay?
That makes-
There's,
I thought
again,
so, yeah.
there's not much we can sort of do about that because the way, again, it's looking at the trunk, alrighty? If we're looking at doing this test against gravity position, it's gonna be hard for us to do a resistance mover, either sitting or standing. We just can't do it, alrighty? It'd be very difficult.
You can
getting
do it for the
tired?
upper traps though, right?
Upper traps, yeah, upper traps, yeah. Alright, are you getting tired? You sure? Okay, because there's at least 3 more. Okay, okay. Alrighty, so that's for scapular depression and upward rotation, looking at the lower traps. Okay, now if you are looking at scapular downward rotation with the scapula, alright? Alright, so scapular downward rotation and adduction. So basically what we're looking at is looking at retraction, and particularly the rhomboid major, alright? What's the other? Middle, oh shoot, I just said it.
Middle trap.
Middle trap, right? Middle traps, okay? So we're testing the rhomboids now, and that's a layer deeper, right? So what she's still in the right position, alrighty? Can you put your hand in the small of your back for me, please? Here. Just one. Okay, we're only doing one, okay? And, okay, what do you think I would have her do now? Alright, to sort of get her to retract a little bit with her rhomboids. This is, okay, right, she's trying, she's trying. What else? Right, what did she actually do?
My elbow back.
Yeah, she just bent her elbow, right? Try this now. Can you lift your arm away from the small of your back? You get more of a retracted motion. Okay, put it down. Alrighty. Okay, since you're right here, right? Can Kevin place his hands there so he can feel? Okay, he's gonna put his hands right in the mid trap area, the medial side of the scapular area. Okay, right here. Okay, alrighty. Can you, keeping your elbow bent like that? Okay, just lift your hands straight away from your back, please. Okay, go up. Feel that those are her rhomboids contracting. You're facilitating the rhomboids, not so much her middle traps at that point. Okay? Now, looking at her, okay, and looking at what she just did, what position do you, or where should I put my hands for resistance, you think? Where should it go?
Her
That's the
elbow.
side of her humerus?
Yeah, pretty much on the medial side of her humerus, okay? And what you're gonna be doing is a downward and lateral type resistance, because we are asking her indirectly to adduct also. So it's gonna be downward and out a little bit as she's lifting up. Alrighty? So, okay, let's see. Alright, so put your hand back in the small of your back, right here. Alrighty? You're gonna do the same motion now. Kevin's gonna still palpate for the muscles, okay? Alrighty, so on the count of 3, alright, I want you to lift up your arm away from your small of your back, okay? 1, 2, 3, go, 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 go. How's it going there? A
It's
lot.
more, yeah.
Good. And actually, I'm playing a decent amount of resistance, a decent amount, alright? So for her, I'm probably somewhere between 3 plus, oh, excuse me, and 4 minus. Somewhere in between. Ooh, thank you. Oh God, allergies this season is starting already.
Oh.
Oh yeah. All right, so that's for in a against gravity position, right? For the rhomboids muscle. Okay? Yes or no? Right. Okay. Question so far?
Why is that the rhomboids and not the middle traps?
Because you're adding a deduction component to it. You're adding an adduction. Because as soon as you place your hand over here, alrighty, you're abducting it, your scapula a little bit. Alrighty, so you're looking at the rhomboids itself. Right? We're gonna jump ahead now and just look at the middle trap component. What would I ask her to do?
Retract.
Just retract. So what would I tell her to do? How do we make sure she's doing retraction only?
T.
T?
The T shape?
Yeah, T-shape, very good, T-shape. Alrighty, but what would I ask her to do? Because what else did you just do when you did that?
Pull your shoulder blades together.
Abducted,
And you went like that.
squeezed my shoulder blade.
Squeeze your shoulder, and you also went into horizontal
Right,
abduction.
horizontal.
So, you want to make sure you don't get the posterior deltoid. Right? So what are you going to just ask her to do?
Squeeze your shoulder.
Squeeze your-
Squeeze your shoulder blades together. That's all you're gonna ask her to do. Alright, because you don't want the posterior deltoid to help. Because the posterior deltoid will help, because it's a big guy, right?
Right.
If you're looking at the muscle size of the posterior deltoid to your rhomboid major. Rhomboid major, relatively flat, rhomboid shape. Posterior deltoid, kind of bulky-ish. Yes or no?
Yes.
Alrighty, so, she definitely needs a towel roll for this one. Okay, can you do that again for me? Okay, alrighty. You can do whatever you want on that one, okay? We're only gonna do this. You want another one? Okay. Alrighty, so, alrighty. When you're doing this, it's very hard for one person just to pinch one of the shoulder blades together, alrighty? So what I'm gonna do, I'm gonna facilitate, I'm gonna put your hand on the other side, okay? Alrighty, I'm gonna facilitate this by just putting my hand in between on either side, on both sides of the traps, okay? And right in between her vertebral column, so she knows. So over here, okay, can you sort of pinch your shoulder blades together? Just go squeeze. Okay, try not to lift up, okay, as best as you can, okay? You know what? Bring your arm down slightly right here, okay? Now try to do it. A little bit better, okay? She's still trying to bring her upper traps into it because it's not a natural thing to do all the time, but she did a little bit better, okay? Then I did feel her middle traps. You wanna palpate? Okay, right here. Okay. Squeeze? Yeah, okay. Now, what would I do if so that's against gravity. What would I do, okay, for against gravity with resistance? Where would I put the resistance?
Above her elbow.
Scapula?
Yeah, right. Well, not on the scapula, right? And not over here, because it's just too close, she's not gonna be uncomfortable. So just sort of right
Above the elbow.
right above the elbow. So, what do I have to make sure she doesn't do already? What are they gonna try to do?
Oh, she brought her
Yeah.
arms in.
Brought her arms as best as I can. I'm gonna instruct her, okay? Okay? Alright, so, question? No, okay. Alrighty. Try to keep your hand a little bit over here if you can, if possible, okay? Alrighty. Now, I want you to pinch your shoulder blades together. While you're doing that, alrighty, Dennis is gonna just sort of palpate for the muscles, alrighty? I don't want you to lift up this arm off the table as best as you can, okay? Alrighty, you know what? Need help? I'm gonna do this. Lift up one more time. Alright, okay? So it's a little bit better. Alrighty, so on the count of 3, 1, 2, 3. Pinch, 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 pinch. Do you feel more muscle fibers coming into play?
I do.
Yeah, it's her pet. I am telling her, yes, she did do an adduction type of thing. She did shrug a little bit. Not much we can do about that, right? It just sort of happens. Okay? Right? Questions? Right? Right, yeah.
What exactly is it that determines it being a gravity eliminated
For
position?
this is for gravity eliminated, we would get her out of this position. Okay? So for gravity eliminated for middle traps and rhomboids, where do you think we would have her? Sitting. Okay, so can you sit up for me? Okay? Hey. Okay, so yeah, I'll go over to the other side. Actually, no, can you sort of sit that way? Alright, so these guys can see. Alright, so. Alrighty.
Yo, you look out of it, you alright?
I'm gonna sit up here. Okay. Alright, can you guys see over there? Alrighty, so for the middle traps, okay? Alrighty, what do I need to do to make sure? Where would her arm be? In this, I would have her more here, because I could support better. Alright, I don't have to worry about it. If she's here, alrighty, she might push down on me, but if here, I just support her a little bit better. Alrighty, so in this position, okay, can you just pinch your shoulder blades together? 1, 2, 3, pinch, 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 pinch. Alright, don't, try not to push your elbow back or pull your elbow back. Just pinch your shoulder blades together. Better, alrighty? And again, it's a gravity eliminated position. I don't feel as much of the muscles contracting because it doesn't need to, because she's in a gravity eliminated position. Yes or no? Alright, one more time. Okay, my hands are right here on the medial side. Alright, both of them, and like I said, I put my hands right on both sides, more just to help the patient understand more. Alright, on the count of 3, pinch, 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 and you could see she's not going into horizontal abduction because I would instruct her to do this. Okay? Alright, now for the rhomboid major and minor, can you place your hands right here? Right, and the small on the back again. And I want you to sort of see this. Bring your hand over here for a second. Alrighty. Here's her medial side, inferior angles right here. I'm gonna cup it. Is that okay? Alrighty. Now, okay. Do you want a chair over there? Just sort of stick it. If patients sort of feel uncomfortable with their feet hanging and dangling away, give them a stool or a chair, because it is a little precarious sometimes. Alright. So I'm gonna keep my hand here. Alrighty. Put your hand in the smaller back. Did you sort of see how it abducted a little bit and popped out?
What, the scapula?
Scapula.
Yeah,
I'll do it one more time. Okay? And I sort of fold the shirt a little bit. Okay. Alright. Alright. So right here. Okay? I'm sorry. You want the chair? Cause you felt you sure? Okay. Alrighty. Now put the hand in the small of your back. You can see how it sort of pops out and abducts a little bit. Alrighty. So what I'm gonna ask her to do now, okay? Can you? Oh yeah, here we go. Can you bring your elbow, keeping your hand here, sort of like bring your elbow back towards, back, okay? On the count of 3. 1, 2, 3. Right? 80 ducks a little bit. Alrighty? You want help?
Oh, the scapula AD ducts?
80 ducks. Okay? Alrighty, sort of stand on this side. Yeah, put your finger right here. Okay? 80 duct. Oh, sorry, bring your elbow back. Can you see how it 80 ducks a little bit?
Yeah.
Go towards the midline.
Yeah,
Okay? Yes or no? Good?
Yes, ma'am.
Okay, so this is scapular upper rotation adduction, okay? In a gravity eliminated position. Yes or no?
Yeah.
Okay, you good? Couple more. Okay, a couple more. Hey, upper trap, since she's sitting right here, what would I ask her to do? What would I ask her to do?
Well, for gravity
Up,
eliminated?
up, is this gravity eliminated
For
position?
upper
Upper
trap?
traps. Upper traps. You guys tell me.
Yes.
Gravity eliminate?
That's
What does upper
against-
traps do?
That's against gravity.
That's against gravity, and what would I tell her to do against gravity for upper traps? Raise the shoulders, okay? Usually, if you happen to pick this one, okay, alright, and you happen to get the right side, it's okay to just say, shrug your shoulders, right? Because it's kind of a weird thing to do if you're only doing one side sometimes for people, okay? I mean, it depends on the person, alrighty? So, keeping your hands here, making sure she's comfortable. Actually, put your hands on your lap, okay? Because if she does this, what may she try to do? If she's like pushing down. She might activate what muscle, you think?
Try.
Huh?
Tricep.
Possibly her triceps, the lower traps. So it's better off to have her hands in her lap, okay? Alright, because you know, you want to make sure they don't cheat as much. Alright, so with your hands in your lap, can you just sort of shrug your shoulders for me? 1, 2, 3. Alright, good. Alrighty. What would I say to her if, you know, what else can I say to her besides shrug your shoulders?
Raise your shoulders, lift your shoulders.
Lift your shoulders, alrighty?
Shoulders to the ceiling.
Yeah, go to the ceiling, okay? You don't want to say bring your shoulder to your ear, because what are they gonna do?
Gonna lean.
They're gonna do this, okay? So be aware, things like that. Now, if I wanted to add resistance now to it, where would I be? Yeah, right on the shoulder, okay? Alrighty? Alright, so let me do the palpation first. I'm just gonna palpate for the muscles, okay? So on the count of 3, I'm gonna just put my hands right below your neck area, okay? So on the count of 3, bring it up one more time. 1, 2, 3. Alright, and back down. Nice traps working against gravity. If I wanted to apply resistance, where would I put myself? Behind her. People don't like this.
Right.
Okay? They get, first of all,
Personal space.
major violation of personal space. Okay? Because you're really in them. Because you're gonna, when you start resisting, you're gonna really, if they're strong, you're gonna start putting a lot of resistance down on them. You're gonna there's always that violation of personal space. So need to be aware of that. So I'm gonna be here. If you are on, where does your go? On one of those chairs, you could be just easily standing right behind the chair. Okay, she's here. Alright, if you're gonna choose this and you're gonna start adding resistance, I would definitely stabilize her feet in a way, and it's not just stabilizing by crossing her ankles. I would put something under her feet, alright, just to make her feel more comfortable. Okay, save time. We're just gonna do it this way, and you know, I'll stand on this side. Okay, so you guys can see. Alrighty, so on the count of 3. I want you to lift your shoulders up, and I am gonna just apply some resistance in a downward direction, okay? Ready? 1, 2, 3. Go, 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 go. All right, and you can see all the one starts coming into play. All right, and what did she also try to do? You guys saw. She tilted a little bit, okay? So usually a chair would be better because I'm a little bit more advantageous because I was like this, all right? Not as comfortable, all right? If I'm in a chair, better position, okay? Alrighty, so what position would be gravity eliminated for this? Supine. Supine. Supine is more comfortable than prone.
Yeah.
It's just more comfortable. Is it wrong doing it in prone? Probably not, but they're just not as comfortable. Alright, so can you go supine? You know, yeah. Do you want one of these? Does that make you feel comfortable?
Yeah.
Okay. Alrighty. Alright, so if I needed to palpate for muscle, where would I be?
We're about to find out.
Hmm?
I was just asking a question I had, like, how would you apply resistance? Like,
Yeah. If I was gonna palpate for the muscle, where would I be? Is this a good spot for me?
No.
No?
It's okay.
Yeah.
You can
Yeah.
slide in it.
Yeah, I'm just gonna slide under it.
Palpation, yeah.
Yeah, for just a palpation, okay? Alrighty, and I'm not gonna make sure I'm not in too much of her personal space here. So on the count of 3, if I'm testing, which one have we been doing? We've been doing primarily the right, right? Right? Usually, again, in this position, they definitely like to do both at the same time. Alright? Can you just shrug your shoulders for me this time? 1, 2, 3. Good. And I would feel for the muscle contraction, okay? Bring it back down. 1, 2, 3. Good. Yes or no? This one's an easy one. Okay? Alright. Alright, last one. Are you good? Okay. Alrighty. Alrighty. Would you like a real pillow now?
Oh, no.
You sure? Okay. Alright, come towards me. Last one is scapular protraction. Alright, it's the last one there. Okay. Alrighty. Alright, it's scapular protraction, also called scapular upward rotation and abduction. So, alrighty. Can you, okay, on what's protraction again?
Rounding the shoulders.
Rounding the shoulders forward, okay? But we don't really want it to round, because when we round, what may we tend to use also? The pecs. And we don't want the pecs coming. Because looking at the pecs, is the pecs bigger than the, say, the serratus guy?
Yes.
Yes. So we don't want to just tell her to round the shoulders. So what we're going to ask her to do, right, because you really do want her to just protract, I'm in the gravity eliminated position, what would I say?
Push further.
Well, push, I'm going to really push. I'm going to push. All right, what would I say? When you say tell people to push, they're going to push.
Reach.
Right? So reach forward. All right, so this is the gravity eliminated position. Against gravity position, she is in a supine position. So what would I ask her to do? Reach your arms up there. Reach for the ceiling, okay? All right, so I need to stand on a stool because I'm short. All right, can you bring your arms up to 90 degrees for me? All right, like this. Can you, all right, just sort of reach for the sky for me, okay? 1, 2, 3, reach, reach, reach. All right, and what you would feel right on the lateral side of her scapula, right, and the rib cage is her serratus muscle coming into play. All right? So, yeah, against gravity. Okay, so I'm gonna reach for the sky again. Good, and I would feel those muscles coming and say, I'm looking at the lateral side of her scapula, alrighty, and sort of the lateral rib cage area. Right? So, if I wanted to add resistance to this now, what would I do?
Hold when she's pushing.
Push into
Push the
it.
hips.
Push into
Push
her
into,
hand.
which way am I pushing?
Down.
Down. I'm pushing downward. Okay. It is not the most comfortable test in the world, by the way. Alright? Because what basically, where would I push down? Would I push down here?
No.
You think?
Roll.
No, because what am I doing? I'm getting her whole forearm, triceps, elbows, doing like a cold contraction thing. So I'm going to be basically in this position. Alrighty? What do people tend to do when you're holding something like this? What do people tend to do? I'm supposed to push downward, right? For me to get leverage, what may I try really hard to do?
Squeeze.
I'm going to squeeze, which is not a good thing to do. Okay? It's uncomfortable. You got to remember, you want to have a good hold in this area, but you want to make sure you're not hurting them. Because you don't want to give them like a, what do you call those things?
Indian bun.
Yeah, an Indian bun. Okay. You really do not want to give them an Indian bun because it is, because you're going like this, but people tend to, squeeze when they do something like that. So you need to be careful because it's only a downward direction. Alright? So, alrighty. Okay, so can you do it one more time for me? Just reach up. Good. Now come back down. Alright, if she's weak, what may she do, by the way?
What's up, trunk?
This?
Or tilt?
Tilt, roll her trunk, alrighty. She may do, some people do something with their wrist and their elbow, alrighty. Some people do, alright. Alright, so this time you're gonna do it, I'm just gonna apply some resistance, okay? Try to relax this part of it. Don't bend it, but you know, don't lock it, okay? Alrighty, so on the count of 3, you're gonna reach up and I'm just gonna push you down from here, okay? 1, 2, 3, go, 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 go. And relax. And what do you feel me doing with my thumbs, really, and these fingers? Do it again. Okay. 1, 2, 3. Go, 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 go.
I can see her compensating.
Yeah,
too,
yeah.
With the other shoulder.
Yeah, she's bringing it up, right? And I was already really pressing in with my thumb because it's a natural reaction. So do be careful, all right, when you're practicing this one. Okay? All right? So again, looking at what they do, okay? All right? What position would be gravity eliminated?
Sitting.
Sitting. That, she would actually be going into gravity at that point, okay?
You want with
Alright, she would be going into gravity because I would have her prone and pushing, and she would be reaching down.
Right.
Okay? So gravity eliminated would be a sitting position, okay? So can you sit? Last one. Okay? And, face me. And this side, right? Alrighty, so she's gonna. Alright, good. Alrighty, so I'm gonna have her in this position, alright? What may she try to do in this position? What does this looks like? Kind of familiar.
She might like tilt.
Tilt, okay. And what other position was this similar to? Horizontal.
Oh, yeah,
So
yeah,
I
yeah.
want to make sure she's forward flexed. Okay, I'm gonna need to be up here. Right, drop it in my hand. Okay, alrighty, and I'm gonna give her the appropriate directions. I'm just supporting you, right? Okay. Can you reach forward with your arm, please? On the count of 3. 1, 2, 3. Reach. Okay, good. Alrighty, and back. Am I doing anything, by the way, besides holding? Okay, so I'm just supporting her. Alrighty, gonna place my hands for the palpation here on the lateral aspect of the scapula. Alrighty, so can you reach forward for me one more time? 1, 2, 3. Alrighty. Oops. Okay. Do it one more and bring it back. Alright. Put my hands here a little bit more. Reach forward one more time. 1, 2, 3. Good. And back. Okay? Alright, I'm supporting her. I'm in a good position to watch for anything over here. Okay? So again, test these on very, different people. Because you're gonna have, some people are relatively stronger in one area in your class. Some are gonna be a little bit weaker in the other area. So for you to sort of, get an idea of how, how much resistance and where you need to be advantageous for performing the test, you need to practice on everybody. Okay? Alrighty, so you guys are gonna practice, right?